Thank you, Ray, for that. Well, it's football season, and it's not unusual to hear about an athlete suffering a torn ACL. In basketball, we hear it. But did you know this is one of the most common orthopedic injuries in dogs? Did not know that. IndyVet's Dr. James Speiser knows all about it, though. I brought Rosie to talk to us a little bit. It's different, though, in humans than in our dogs, right?
That's absolutely. As you said, it is the most common cause of rear limb lameness and arthritis in dogs. But dogs' disease is different than people. Whereas people, it's a traumatic disease, football field, skiing, or whatever.
Yeah.
In dogs, it's actually a degenerative disease. It's genetic, where the ligament actually is getting weaker over time. Then with obesity, lack of exercise, and so forth, you may let them go out to potty and they break their cruciate ligament. Now, because it's degenerative, if they break one, you can expect about half of them will break the other one in a short period of time. If we look at Rosie's knee, look at
Rosie's
this.
knee.
You know, her knee is at an angle here. They don't stand straight up. It's bent. And so their disease is a lot different. I think we have a picture.
We're going to show the photo of, now is this photo that we're going to look at what it should look like? Or
well,
what
this is the anatomy actually of the ligament. There's an arrow there that shows that little tiny ligament inside the joint that prevents the upper bone from riding backward on the lower bone. And when that ruptures, there becomes an instability there, which causes pain and subsequent lameness and arthritis.
Okay, how do you know that they have to come in and have an X-ray, or you don't do MRIs?
Well, you can, but actually it's a diagnosis that can be made by physical exam.
Okay, how do you treat it?
You know, surgery is really the best way to treat it. Their dogs' limbs are hard to put a brace on because of their shape. But if we look here on the left, you can actually see this is a preoperative film, and there's a line that cuts across the tibial plateau that's at a big angle compared to the lower bone. On the right, this is after we've done surgery. We made a cut in the bone. This is called a tibial-plateau-leveling osteotomy, or TPLO, and we have rotated the bone so that now it's flat, and you can actually see the line going across is like perpendicular to the other. This eliminates then the instability and allows dogs to walk well.
We're almost out of time, but we wanted to show this video too because they have to rehab. I mean, you can't just have surgery.
Absolutely. After surgery, you have to have about 8 weeks of not very much exercise, and then rehab is very important. This dog, you can see actually her left rear leg there is shaved and had surgery, and she's in rehab. With rehab, these dogs can be up and running around just like new in 12 weeks.
12 weeks?
Yeah.
So kind of still a long time, but not, I mean, after a big surgery like that. Well, Dr. Speiser, thank you, is with IndyVet Emergency and Specialty Hospital. For more information, fox59.com/links. Now you know, had no idea, Jim O'Brien. But thank you.
Okay, you're welcome.
Informing us, as always.
All right, thanks a lot, Ange. We're at 9:06.